So, why exactly is methylation so important? Well, methylation at its core is a very, very important process that's found in all of our cells and is very key in a couple of different important things. One, to remove toxins, in particular carcinogens. Two, to repair damaged DNA. And three, to actually, it's very, very key in the formation of new cells as well as the production of important anti-aging hormones, testosterone, growth, estradiol, thyroid, among others, and DHEA. So very, very key process that we need to optimize fully. The other issue, of course, is when this process is impaired, you're much higher likelihood to develop heart disease, Alzheimer's, cancer, diabetes, and liver disease. And the best part about it is it's a really simple thing to optimize. It's really just a matter of optimizing things that add methyl products to your bloodstream and things that accept them. So when I talk about methylation, what exactly is it? So methylation is really the transfer of a methyl group. So a methyl group is just one group of carbon attached to three atoms of hydrogen. And what it really is doing is you're transferring methyl groups, this carbon and three atoms of hydrogen between molecules. That's all it really is. And it occurs millions and millions of times a day in every cell of our body. The main issue is that there's a balance between compounds that donate methyl groups and compounds that accept them. This is a very simplified diagram of the methylation cycle, and you should just think of this occurring again frequently in all of the cells of our body. And what this really is you'll have methionine, which is a very important methyl donor, oftentimes found in meats and dairy, etc. That undergoes demethylation with methylating factors, such as B12 and folic acid, and methyl groups are then transferred over, and then it's converted to homocysteine, right? And homocysteine is then converted back to methionine via the process of additional methyl donors and methylating factors. When you don't have an appropriate amount of methylating factors like B12 and folic acid, you tend to have an accumulation of homocysteine. And just to clarify that a little bit more, methyl donors include things like methionine, choline, trimethylglycine, and SAMe, but methionine being the biggest one, we get that from our diet. And methylating factors are the B vitamins, B12, folic acid, as well as zinc is also an important one. And why exactly is this so important? Well, as you mentioned, when you have high homocysteine levels, in other words, when the balance between methyl donors and methylating factors is deranged, it can lead to a host of different diseases. And here are just a couple of articles indicating that high homocysteine levels have been linked to heart disease. It looked at several different studies that have shown that an elevated homocysteine level is associated with increased risk for developing atherosclerosis, which can lead to coronary artery disease, heart attack, and stroke, and that's well known. There are studies suggesting that disturbed homocysteine metabolism or high homocysteine levels are associated with cancer. And there's quite a bit of research suggesting that high homocysteine levels is associated with Alzheimer's, right? So it's really key to get these levels within range. How exactly can you tell if you are methylating appropriately, right? Well, the good thing is you can assess this primarily by looking at your homocysteine levels. The key thing to remember is if they're low, your methylation cycle is probably working well. If it's high, it's likely that your methylation cycle is impaired. And therefore, it being high, the risk of those diseases we talked about, Alzheimer's, cancer, heart disease, etc., are much higher. And what is too high? I try to keep your levels between 6 to 8 micromoles per liter. And as you can see, the risk of coronary artery disease increases significantly with every increment of 5 above 10, right? So ideally you want to, so 6.3 might be a little bit extreme. So 6.3 to 8 is a pretty good range. If you can get below 6.3, like some of my patients, that's wonderful. And you have a very, very low risk of developing coronary artery disease. But once you get to 10, you're twice as likely, 15, 4 times as likely. And it's with a recent patient of mine who had a homocysteine level of 26, he was 12 times more likely to develop coronary artery disease. So really, really key to lower it down. Even though the process of methylation is complicated and diseases associated are pretty numerous and it occurs in all of our cells, the way you treat it is super easy. So again, it's just a balance between donors and acceptors, right? The key issue I see is not so much that people have too little methyl donors. Most of us have plentiful amounts of methyl donors because we tend to get a fair amount from our protein sources, such as meat, fish, eggs, whole grains. Where the issue usually arises is with the methylating factors, the things that can remove the methyl groups. And that, again, are the B vitamins. And why would that be the case? So it's linked to a couple different things. But some of the main reasons are just processed foods, which are very low in B vitamins. If you tend to get a lot of fats and sugars, that also seems to deplete the store of vitamins. As we get older, our absorption of B12 in the gut seems to decrease. And then one thing of note, and this is more on the methyl donor side, as I mentioned, most of us tend to have a preponderance of methyl donors. Red meat is extremely high in methionine. And so if you eat tremendous amounts of it, you'll have a preponderance of methyl donors, and it'll be really hard to offset it. You have to get a ton of these methylating factors, a ton of these B vitamins. So the better way is to make sure you have the B vitamins on board, but reduce your red meat consumption. Try to reduce it to no more than once a week. And how much should you take? Well, the dosing that I would recommend is the following. You probably want to get at least 8 to 1,600 micrograms of folic acid, 100 milligrams of B6, 5 to 100 micrograms of B12. And then there's this particular compound, trimethylglycine, which I occasionally use in patients who have severe homocysteine. That individual had a homocysteine of 25. First, we're going to do dietary interventions, but if he is unable to reduce his homocysteine to that 6 to 8 level, we may introduce some trimethylglycine to a supplement regimen. So here's the cool part. It can take within a few months. It's really, really quick, particularly if you make strict changes to your diet and then start utilizing appropriate amounts of the B vitamins. And you want to use B vitamins that are easily absorbed and already methylated. They seem to work. They seem to be absorbed a little bit more. Those are the ones that I would strongly recommend. And so you might be thinking, well, do I have to take a whole bunch of supplements? No. The VitaPack has a B complex vitamin, and if you take this twice daily, as you're going to be directed in the instructions, you'll get more than enough of the B vitamins necessary to optimize your methylation. So just make it simple on yourself. And again, obviously, you want to make sure that you are checking your labs concurrently. So that's why it's so key to, when you see those lab requisitions sent out, get them done. That way we can assess that your homocysteine levels are reducing, that we're moving in the right track. And that is, really key, of course, to reduce your risk for chronic illness and obviously promoting your longevity. Again, just to recap, methylation is a very, very important process that's found in all of our cells. It's key for DNA repair. It's key to improve hormone production, and it's key to detoxify a lot of organic pollutants, particularly in the liver, right? If we don't methylate appropriately, we're going to put ourselves at risk for a lot of chronic illnesses, cancer, heart disease, Alzheimer's, and it's so simple to fix. Fix your balance. Usually it's by adding in those methylating factors like a B complex vitamin, and then reducing the amount of methyl donors if need be. Red meat would be the biggest culprit, and that's what I typically tend to move away from.